I'm Kelly Warner. Through the development of immunotherapy, scientists are learning how to boost the body's own immune system to identify and attack cancer cells. Immunotherapy is showing successful results in about 15 to 20% of cancer patients, and researchers believe more life-saving breakthroughs are on the horizon. At Willamette Valley Cancer Institute in Corvallis, the daily goal for Dr. Keith Wells is to outsmart cancer and save lives.
And there's cancer here next to the big blood vessels.
With the advancement of immunotherapy, which boosts the body's own immune system to target cancer cells, patients have more treatment options than ever before.
With advances in molecular and cellular biology, we started developing antibodies. Antibodies are proteins that bind other proteins. And the antibodies could be directed at specific proteins that are on the surface of cancer cells. And they were able to target the cancer cells, and then the body would also help to eliminate those cancer cells. Now there are probably hundreds of antibodies that are being used, including the newer checkpoint inhibitors.
Several drugs called checkpoint inhibitors are already FDA approved to treat melanoma and other cancers, including kidney, lung, and bladder. And additional drugs are currently being studied in clinical trials. While traditional cancer treatments like chemotherapy often damage healthy tissue along with the cancer cells, immunotherapy is more targeted and better at sparing normal tissue with less severe side effects.
Whereas traditional chemotherapy makes people tired, makes people fatigued, nauseated, and a whole host of other things, the immune therapies really don't have those traditional chemotherapy side effects. And so I think over the next few years, a lot of these big trials are going to help sort out where should these treatments go, should they be first line, second line, and which patients will get the most benefit from them.
The hope is to develop an arsenal of effective therapies so that oncologists like Dr. Wells can turn a patient's potentially life-threatening cancer diagnosis into a manageable illness.
And that's part of the ultimate goal. So a lot of the blood cancers and even some of the solid tumors with these immune therapies, people can live years and years and years with their disease.
One of the newest areas of immunotherapy is CAR T-cell therapy. Doctors remove immune-boosting T cells from a patient, engineer them to fight cancer cells, and infuse them back into a patient's body. Last year, the FDA approved 2 types of CAR T-cell immunotherapy for treatment of adults with advanced lymphomas and children with acute lymphoblastic leukemia. I'm Kelly Warner.